Welcome to the Keystone Blogcast. Today we're going to talk about a topic that's pretty near and dear to most people that have ever experienced, the throbbing or pain of a migraine headache. It's actually one of the most common reasons that we actually get referrals from other doctors, including neurologists and especially dentists, because migraine headaches have a devastating effect on someone's life. And anyone that knows or experienced a migraine has spent time having to shut themselves up in a closed room with no lights, sounds bother them, and sometimes a migraine can actually linger for hours, if not days at a time. So the socioeconomic impact of a migraine headache is huge, and there's tons of people that are looking for answers, and a lot of people who have tried drugs like Imitrex, have gotten Botox therapy, and have just gone through with all these different solutions to try to address the pain in their head just to be functional in their life. What a lot of people don't realize is that there are many times where a headache is actually not a chemically based solution. There's actually a physical problem that's going on for someone that's suffering with migraines. And the Atlas displacement complex is actually one of the biggest problems, one of the biggest reasons why people have this problem. I'm just going to explain in a couple of minutes why this happens. So when we look at the normal structure of a head and neck, what you should see is your head bounce on top of the neck, bounce on top of the lower neck. When you have this structure, then you have normal blood flow going in and out of the brain. You have less tension on the brainstem and the spinal cord. You have normal signals that are going into the brain. Therefore, everything tends to work easier and better. What can happen is, from accidents, from falls, from poor posture, that head and neck can actually start to shift and lock out of place. And as it starts to shift and lock out of place, it's actually damaging the ligaments, it's stretching and compressing certain muscles, and one of the most important things is it's actually reducing the flow of blood going in and out of the brain. As that starts to happen, something called central sensitization happens to the nervous system. And all that means is the nerves start to become more sensitive than what they would normally be. Everyone has varying levels of pain tolerance. When our nervous system isn't working properly, sometimes that pain tolerance can actually go way down, and just a simple little stimulus like light shining too brightly or someone touching you the wrong way, as someone putting a slight little pressure, can cause intense amounts of pain. So when you have central sensitization, that's going to leave people more prone to chronic pain and the effects of something like a migraine. Instead of just trying to treat the pain and make the pain go away, we're focused on correction because we want to restore the normal blood flow. We want to take the pressure off those nerves. And we want to allow your body to go through the normal healing processes on its own. As a result of doing those things, then people can have less inflammation going into the brain. They can have regular, more normal function of the nervous system. And most importantly, the body can really start to heal and repair on its own, rather than having to rely on chronic use of prescription medications or chronic shots in order to try to control the pain every time it comes up. So the next time that you're thinking about getting a migraine treatment, or the next time that you know someone that's been suffering with migraines and just really hasn't been able to have a solution, then you might want to investigate getting their Atlas checked out to see if structural chiropractic is right for them.